Today we are in beautiful San Diego and Coronado, and on location. We drive around, we travel around to bring you the best physicians, doctors, providers that in the personal injury world and introduce them to you guys. So I hope you guys are enjoying the scenery as much as I am. I have my sunglasses on because the sun is beating in my eyes, so I'm not trying to look cool. I just have it because I have to. So again, welcome. Today we have a very special guest, Dr. Kam Raiszadeh, MD, orthospine surgeon. Doctor, welcome to the show.
Thank you so much for having me.
Thank you for bringing me all the way out here to do this show because I'm very, very happy now. And it's a real pleasure to have you here. So, Doctor, tell us a little about yourself.
Yeah, as you mentioned, I'm an orthopedic spine surgeon. So I specialize in doing minimally invasive surgery in the neck, thoracic spine, and lumbar spine. I have had a lot of extensive experience in also non-operative care, maximizing non-operative care prior to choosing to do surgery for a condition. And if I do surgery, I try to find the least invasive way to do it using modern navigation, for example, minimally invasive techniques to do either decompressions or fusions, so that you don't have any of the side effects of surgeries, which is the muscle wasting and other things that can happen if you have to do the standard traditional operations.
Fantastic. So, tell us about your background, education. How did you become this wonderful physician that we see today?
Appreciate. I did all my training in Northern California. I went to UC Berkeley and UC San Francisco for medical school. And then I did my residency in Sacramento at UC Davis Medical Center. And I did my fellowship in spine surgery in New York City. And then when I came to San Diego, we actually had a training program called the fellowship program for spine surgeons. And so I did that for close to 5-6 years and worked very closely with folks at UC San Diego in a more academic setting. And then I've gone off on my own now and established clinics that both help folks in the non-operative side and as well as in the surgical side.
Right. And what Dr. Raiszadeh just said is very important, is the biomechanics after the surgery, which is minimal invasive. It's all about the recovery time and the functionality. We know there's some guys that are I call them the pick and hammer guys, right? And then, obviously, if it's warranted, it's wonderful. Tell us about what is minimally invasive and the recovery time compared to non-minimally invasive.
Yeah, so it's quite a remarkable difference. Like if you look at the standard way in which surgery was done, you have to spread and take all the muscle off the spine, which then that muscle either turns into fibrous tissue, meaning like it's just scar, and it loses its functionality. So even though you may have a fusion in the spine, your back muscles are not working as well. That leads to more problems at other levels. That's what minimally invasive surgery can help you prevent, so that you only deal with the area of concern and you leave as much normal tissue and as much normal kind of muscle function that then supports the spine. So that's, I'm hoping for a one and done operation. I don't want someone to have one surgery after another. So you really have to think ahead and try to prevent that.
Wonderful. And as far as the types of surgeries you do, microdecompression, fusion, any disc replacements?
Disc replacements in both the cervical and lumbar spine.
And the lumbar, which most doctors, just FYI guys, most doctors do the neck, and some that are extremely, extremely experienced do the lumbar area. The neck is much easier than the low back, and doc does low back, which is phenomenal. And the age group you like to operate with disc replacements?
Usually younger, who don't have, the thing you want to have with disc replacement is you don't want to have a lot of other joint problems on the back of the spine. So if you look at the spine, it has a disc in the front and 2 joints in the back, facet joints. If someone has a lot of facet problems or they bang that up in the accident, it's probably not a good idea for a disc replacement, no matter what the age. But as long as they have normal, good anatomy otherwise, and the main problem is the disc, which is really 90% of the time it's the disc that's the problem, then you could just isolate the disc and do a disc replacement.
And I know you're a big fan of physical therapy and rehab because obviously it either might prevent or make the road to recovery better for your patient demographics. You have what's called the SpineZone, which is about, I believe, 8 PT locations, ranging from San Diego all the way to Orange County.
Yes.
So tell us about those places.
Yeah, we've been around for close to 17 years.
Oh, wow.
And work with across both in the PI world as well as with Scripps and Sharp and UCSD. We have published many studies, and it's amazing how when you empower people with, even after a significant injury, if you can empower them, get their muscles strengthened, make them start thinking correctly, what we call the biopsychosocial model. They have to. What happens with chronic pain is people also get depressed. You have to address that also. If you address all these factors, there's a good chance they'll get better without surgery. And that's what we've done and proven in these clinics.
And obviously after surgery, you're pretty much, how do you say, on top of their PT because they're your locations, and obviously you can see them during their care and recovery.
Exactly, because the problem with any kind of immobilization, if you leave people without mobility, for every day that you're immobile, it usually takes 3 days of strengthening to get you back. So we don't want that. So we do early mobilization after surgery. That's also the benefit of minimally invasive surgery, is that you can do that because there's not as much muscle dissection. So there's not as much pain post-op. So you can start rehab and mobilization very early.
Got it. And that also brings me to, which is phenomenal, you're also an AME and an IME, an independent medical examiner and agreed medical evaluations, which is huge because there's always a conflict what the defense says or what the plaintiffs say on the plaintiff side. We always need a just opinion. Not many doctors in the personal injury world do IMEs. So how long have you been doing IMEs for?
Oh, for as long as, pretty close to as long as I've been in practice. I've been in practice for 28 years. I've been doing IMEs for about 25 of those 28.
So that's great. So everybody out there, Dr. Raiszadeh is also an IME, which whether the defense chooses him or whether the plaintiff side chooses him, he's going to give you an honest opinion. And that's crucial for some of these patients out there that really truly need an honest opinion to help them towards their recovery and compensation. So, Doc, which hospitals do you operate at?
At UCSD East, so that's the old Alvarado Hospital in central San Diego.
Right.
Also Sharp Memorial Hospital.
Oh, excellent.
Also at Outpatient Surgery Center of La Jolla.
Fantastic.
And at Scripps.
And your complex cases, which hospital do you prefer?
Usually the more complex one's Sharp Memorial.
Sharp Memorial, which has an excellent reputation, and I've seen it myself. It's an excellent, excellent place. So, Doc, where are your locations as far as your orthopedic practice goes?
My main location is Mission Valley. I have an office in Mission Valley, although I'm starting another office in Encinitas shortly.
In Encinitas, okay.
Yes. And the SpineZone locations are all around town. They're everywhere from Orange County, like you mentioned, to North County to South. But I will have a North County presence within the next few weeks.
Great. So, Dr. Raiszadeh is your orthospine surgeon in beautiful San Diego, or San Diego, depends which movie you guys have seen. He's a pioneer in the field. Use him. He's a fantastic surgeon. I'm very happy we had you on our show, Doctor. Thank you for coming and taking time out of your busy schedule. We'd love to see you again. And for our listeners, thank you for joining us. Always bring you guys the best of the best. I'm on location. We're going to be on location for the rest of the day today, interviewing providers. And join us for the next episode. Thank you very much and stay tuned.
Thanks for listening PI Today podcast, sponsored by Trauma Cash, Global Lean Doctors and TBI Analytics. You can find us on our website, www.pi2daypodcast.com, Also on Instagram, YouTube, Spotify, TikTok, and LinkedIn as PI 2-Day Podcast to watch all our episodes. See you next time.